of the Ministry of Health, our recommendation, and also the international recommendation of isolating and quarantining those patients for a total of 14 days, because this is the time where we expect the test to turn back positive.
I will give you the last question because it was asked more than one time regarding the post-exposure prophylaxis. You mentioned a few words, but is it now really like established, you think, to use the post-exposure prophylaxis as a guideline?
No, it is not recommended, or it is not within the guidelines, but it's something that is really worth exploring. We know that there is a plan for a study to be led by the ministry on the post-exposure prophylaxis. I don't think the study has started yet, but we think that it may start in the next few days or weeks, and that will give us, here in the Kingdom, will give us a better impression about the use of the hydroxychloroquine post-exposure prophylaxis. There are also some studies we are expecting them to come out from China and from Italy about the post-exposure prophylaxis. So I think in the next few weeks we'll know more about the use of this medication as a prophylaxis agent.
Okay, thank you very much, Dr. Reem. We'll move to the fourth lecture today with Dr. Qusay Abed, who's a consultant family medicine at King Faisal Specialty Hospital, and he's the co-director of our residency program. Dr. Qusay will talk about one aspect that is probably forgotten during this pandemic, which is education, which means medical education during the pandemic. تفضل دكتور قصي.
السلام عليكم.
عليكم السلام ورحمة الله.
Is my presentation on the screen clear?
No, it's just I think you are uploading your screen, not the presentation.
Right, try again.
Okay, now you're good.
Okay.
Yeah, very good.
Okay. Right. Assalamu alaikum, everybody, and good evening. Today we'll talk about a side of COVID-19, a difficult time for everybody. Training of residents and undergraduate at the time of COVID-19, especially being a training center in Riyadh. It's an important and it's a new experience for all of us. We had to adapt very quickly to maintain enough and adequate training for our residents during this difficult time. During this presentation, I will share our experience, what we did and what we're doing, and also I'll be speaking about what other things might be done to maintain this training or adequate training for our residents. All of us know social distancing and curfew made it difficult for our residents to get their clinical training and academic training during this time. We all, in the training or in the residency program, we faced a lot of problems during this time. We faced residents having a lot of stress, which is understandable because they're worried about catching the infection, because some of the residents, they had to change the way they do their consultation with the patient. They had to do telephone consultation, which is a new experience for everybody. Also, they were thinking, or they had a problem with, or they thought they had a problem with contacting, getting second opinion from their consultants. They were worried about their exams, their training, their promotion, how they're going to graduate. And from our side, we had to think of ways to adapt and provide the residents with their clinical training and academic activities. How did we deal with the resident stress? One of the things that we did, and we found it very helpful, and the residents find it very good, is regular meetings and communication with our residents through virtual meetings, using WhatsApp messages, telephone calls. We heard their concerns, we solved many problems, reassurance. Our hospital, thankfully, and our department provided the residents with a lot of mental health support. There were special clinics to deal with the stress the residents might be facing. And among the things what we did for our residents is for those who are not needed to be physically present in the hospital, we allowed them to work from home, unless the rota or their training need to be, some group of them will be are actually working in the hospital, but many others are working from home. So we had to change two main things: the clinical training and academic activities. As I said, telephone consultation was a new experience for all of us. To cover the whole clinic through a telephone consultation is a new experience. We had to train our residents. We shared with them a lot of material. We discussed it over in a groups, how to do a proper telephone consultation. We answered a lot of queries, and we're trying to improve this telephone consultation with the residents on a continuous basis. Regarding the academic activities, we used the online learning platform. We have loads of online learning platforms like Teams, the one we're using now. Also, Zoom is another nice platform that we made use of. There are a lot of things that can be done through these learning platforms, from giving lectures, from doing exams, giving MCQs. And what we did regarding the academic activities, all of our lectures we used to do, our residents previously during the normal times, they used to have one session of an academic activity, lectures and discussion about different medical problems on a face-to-face basis. But this time we had to make it over one of the platforms. We use Zoom as the platform that we're using currently. We know from evidence that being an interactive lecture is better than one didactic lecturing or one presenter just speaking. So we had to make this as instructor-led. We meet in a group, and the presenter presents through Zoom, and a lot of discussion happened during this presentation. We also know from evidence that an MCQ or test improves our learning. So we used for every lecture, we conducted 10 MCQs derived from these lectures just to make sure the residents are paying attention, and at the same time, it helps them to learn. One other new thing that we did at these times is to conduct MCQ tests over Zoom, like a mock exam, timed exam over Zoom. So the resident, we send them the MCQs, we time them over Zoom, they answer the question, they send their answers, and we give them the feedback and the result of their tests. This was received very positively by the residents. I feel, and all of us feel, the benefit was really, really good. One thing that can be done also over this one of this virtual platform or online learning platform is we can conduct OSCE exam, although we didn't, but theoretically we can do a telephone consultation, we can do oral exams, and that's something what we think to do in the future. Thanks to the Saudi Council, the Saudi Commission of Health Specialists, has provided the residents with what we call adaptive tutorials, very nice group of tutorials that can be accessed and can be studied online. One of the four of the main courses or these adaptive tutorials about patient safety, communication skills, infection disease and prevention, and code of ethics. They're very, very nice, and the resident can get CME hours by doing this test. I'm just going to show you what can be done when you access these adaptive tutorials online. This is the communication skills, one of the these courses. So it's not just something that the residents can read, but it's more of an interactive, and is a cases for discussion, a real cases from real life. So the resident can press, for example, this patient and give an answer. If the answer is right, so it's more of interactive, more of practical cases for discussion, and it's to areas in the consultation that's very important for our residents. I'll talk now about what are the things that can be used online as well as virtual learning methods that can be used at this time where patient contact can be difficult for our residents. The simplest form of online teaching is just a recorded lecture where the lecturer or the trainer just record a lecture and post it for resident to hear, or just a written material where the resident can read and maybe answer a question. This is the simplest form, but it's not interactive. The benefit from something like this is probably the minimum, but still not bad. The second way is an online adaptive tutorials, like the one I just showed you by the Saudi Council. And it's a method that's been used by the Royal College of Physicians, by the Royal College of Physicians and Royal College of GPs in UK. And it's been proved to be very, very effective. Online learning platforms like Zoom and Teams, which we've been using in our department and we're using now. Also, virtual reality training, like doing laparoscopy as in a virtual reality, which is thanks to our hospital. They provided us with a center that's well equipped with all these late advanced of technology to train our residents. Virtual reality, and I will show you really what it means by a virtual reality training. Also, a mannequin simulation, a mannequin with which is behave like a human and can be used for training, and it's also available in our hospital thanks to our hospital management that cares about our residents. This is a virtual reality that is available and can be used. So this is a virtual reality where the resident can deal with a patient in intensive care situation, and it's all like real pulse, blood pressure. The patient answers the resident, and something that can be used, and it's available in our hospital. That's another laparoscopic virtual reality that can be used, and it's available mashallah in our hospital, where the resident can train to do laparoscopic procedure safely before they come into contact with real patients. And something that can be definitely utilized at this difficult time. And one last thing, the mannequin, simulation, where this is an example. We have in our hostel, I went with our resident, and we saw, and we did some examination on it. They have mannequins like this for surgery, for cardiovascular examination, for chest examination, where you can choose a program like choose from the computer where you want to have a crepitation or a wheeze, and then a discussion happen. This is something that we can use it during this difficult time when a patient doctor contact can be difficult, and we can use it to train our resident in during this time. Thank you very much, and I'm open for any question.
Thank you, Dr. Qusay, for this interesting lecture. I enjoyed it regarding education. So actually, we are running late for our lectures, so I did not see any really specific question regarding the education. However, there was one question regarding from previous lecture regarding using hydroxychloroquine for healthcare workers. Of course, I mean, Dr. Reem is here. It's not recommended. I mean, as she mentioned, Dr. Reem, about post-exposure, it is also still not well established. So, I mean, for exposure, something, and for everybody who's healthcare worker as prophylaxis, of course, it's not recommended for every healthcare worker. So we'll move to the fifth lecture today, and I will be also handing the moderation next to my colleague, Dr. Luaiba Sudan. But our fourth speaker today is Dr. Patricia McWalter. Dr. McWalter is our colleague, consultant family physician in the Department of Family Medicine at King Faisal Specialist Hospital. And she is going to talk about mental health well-being during the pandemic. Dr. Qusay, you have to remove your presentation so Dr. McWalter can upload her presentation. Go ahead, Patricia.
Good evening, everybody. It's nice to be here with you this evening. Ramadan Kareem. So as Dr. Junaid said, I'm going to be speaking tonight about mental health well-being during the COVID-19 pandemic. I'm going to give an overview of mental well-being during the COVID-19 pandemic, and discuss mental health related problems, especially pertaining to quarantine and isolation. I'll also address issues for healthcare professionals and how we can manage mental health problems and maintain mental well-being at this time. So just to give some background, I'm sure most of you are familiar with the definition of mental health. So just to remind you, mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. It's important to mention that this COVID-19 is not a normal stress. It is something that has really taken the world by surprise. It's a very unprecedented event. Just to clarify, again, some terms, the WHO have highlighted very early on that this disease should not be attached to any particular ethnicity or nationality. We should use terms like people who have COVID-19, people who are being treated or recovering from COVID-19, rather than using terms like COVID cases. I'm sure we all use it in our everyday work, but it's just important to keep this in mind. We should separate the person from the disease. This disease does not define the person. Just a few more definitions. Quarantine and isolation, these are terms often used interchangeably. So just to remind us, quarantine is the separation and restriction of movement of people who've been potentially exposed to a contagious disease to see if they become unwell, so as to reduce the risk of infecting others. This term was first used in Venice in 1127 in relation to leprosy. 300 years later, it was used in relation to the plague in the UK. And over the last couple of months, we've seen people in cities in China being placed under mass quarantine. Many thousands of foreign nationals returning from China were asked to self-isolate. Isolation is the separation of people who've been diagnosed with a contagious disease from people who are not sick. So it's just to remind us about these important definitions. I'll talk more about this article published in The Lancet in February, the psychological impact of quarantine. So what's the current situation? The World Economic Forum said in April that people around the world are facing increasing mental health issues during this time. 2.6 billion people are in some kind of lockdown and millions are forced to isolate. I think currently the figure stands at 3 million people suffering from the disease worldwide. So what we have to remember is that this problem could actually lead to a secondary epidemic of burnout and stress-related absenteeism later on this year. So we really have to look at how we can mitigate the toxic effects of COVID-19 lockdowns. So this is a fairly detailed slide, but it's just to highlight, as I said earlier, this important study published in The Lancet, looking at the psychological impact of quarantine. And some of the comments or some of the reasons cited by people under quarantine for the psychological stress they were feeling included separation from loved ones, the loss of freedom, uncertainty, suicide was reported, exhaustion, detachment from others, anxiety, poor concentration, indecisiveness. Some people found that they were struggling with their work performance, reluctant to go to work, and some people even considered resignation. So just to add in tonight, for all the healthcare workers, you can't consider resignation. We have to be there at this time. So other types of general psychological symptoms reported: depression, stress, low mood, irritability, insomnia, post-traumatic stress symptoms, anger, and emotional exhaustion. So I think what's very important with this study is that it highlighted really that the impact of quarantine, the effects are wide-ranging, substantial and long-lasting. But that's not to say that quarantine shouldn't be used. Of course, it has to be used to prevent the spread of the disease. but it's the way that it's done that's important. So first of all, people need to know why they're being quarantined. There needs to be good communication involved. So some more studies on mental health consequences from the CDC. It was mentioned anxiety was very common. And I think this really was coming a lot from extensive news coverage on the pandemic. People reported fear about their own health and the health of their loved ones, changes in sleep, and something very important highlighted by the WHO Economic Forum was the new realities of our newly virtual lives. We're doing this meeting tonight virtually. Many people are working from home. There's virtual schools, virtual family care. So this is something we have to adapt to. It's something that's, you know, again, quite unprecedented. Depression is also reported, mainly related to job losses and economic hardship, and also worsening of mental health conditions. A survey by the Kaiser Family Foundation found that 45% of Americans felt that the COVID crisis was harming their mental health, and 19% said it had a major impact. So I think when we're looking at mental health issues, it's very important that we identify the most vulnerable groups. And usually these are the people who are going to suffer the most negative effects. So people at risk of abuse, people facing job insecurity, children and adolescents, individuals at risk of domestic abuse. Other at-risk groups include healthcare workers on the front line, young people under the age of 30, elderly, and people who are already in very difficult situations because of mental illness, disability, and poverty. I put the domestic abuse slide first amongst the vulnerable groups because it's often often a forgotten topic. Violence against women is actually considered to be a major threat to global public health. Reports from China, UK, and US suggest that there's been an increase in domestic violence at this time. Some of the reasons cited include stress and disruption of social networks. Women also have decreased access to services, so it's important that these services remain accessible. And for us as healthcare professionals, we should always be supportive, listen with empathy, and make sure that we connect survivors to the support services. For children, the CDC have highlighted some signs to watch out for in children, including excessive crying, returning to behaviours that they had outgrown, like toileting accidents. For teens, to watch out for irritability and acting out. Maybe the school performance won't be as good, and also unexplained headaches and body aches. So for children, how we can support children at this time, according to the WHO, we can help children to find positive ways to express their feelings. Art, theatre are very useful ways of doing this. It's also important to keep children close to their parents if it's considered safe. I think we've all seen, pictures and, news reports about children being separated from their families, particularly those working in the healthcare. So in that kind of scenario, if there has to be separation, then children should be having some kind of telephone and video calls with their family. It's also important to maintain routine or to create new routines. And of course, when we're talking to children, to discuss this topic in an honest, age-appropriate way. For teens, again, often a non-forgotten group, we need to tell them that anxiety is completely normal